Hi, I'm Jaya Reggie Mathai, psychiatric nurse practitioner. Today I have Mabel Vichin, doctor of pharmacy, graduate, is with us. And actually, after I start the video on alcoholism, we got a couple of questions. So we and Mabel thought we will discuss about all the comments today. And actually, the first question was, who all are the people? Am I right?
Yes.
Suppose not
Yes.
to use alcohol.
Mm-hmm.
Yeah. So the people who are not supposed to use alcohol, first of all, yes, the person who never had any alcohol should not start drinking alcohol. That is the first one. And second one, the kids under the age of 21. We already discussed about that. And third, when I talk about, there are people who are taking some medication, and they are not allowed to take alcohol. And there are some people who have some disease, especially their liver damaged. They are not supposed to take alcohol. Then there are people like they are working. They need their consciousness to work. The skill need to, so they are not supposed to have. Plus the who is driving, who is going to drive, yes. Then there are, the one we are going to discuss is the pregnant ladies. The pregnant ladies or who is going to become pregnant should not use alcohol.
Yeah, I think that is the focus for today's topic. And the main question, I think, from all teenagers or maybe from youngsters or especially first-time moms, the first question would be, how can alcohol affect the baby or an unborn child? That is the most important question from many of the viewers.
Yeah. And you know that the world is changed.
Right.
Now, before I was thinking most of the male, they are using alcohol. The female is not that much exposed to. Yeah. But now we are thinking, that is in our thoughts only.
Yeah, I think it varies from culture to culture.
Yeah, that's true.
I mean, yeah, the Asian or Indian culture is not as the same as the Western culture. So yeah.
Oh no, you are not that correct.
Okay.
I'm seeing now.
Okay.
As the patients are coming, so I know it's changed a lot. So why the pregnant or going to become pregnant should not use alcohol? Alcohol after all is a toxic. So when an adult takes moderate amount of alcohol, it can metabolize and excrete. It's not going to affect that bad to an adult. But when a pregnant lady is drinking alcohol, the alcohol gets into her bloodstream. From her bloodstream through placenta, it gets into fetus bloodstream. But the fetus, all the fetus internal organs are not developed and matured, especially the liver. And alcohol metabolized via liver. So when the fetus liver is not matured, so all the alcohol is going to be stay there, get into baby's brain. It is going to damage the brain and all other internal organs. And baby cannot get matured and develop as normal. So when the pregnant lady is drinking alcohol, it can end up with the beginning, it can end up with miscarriages, stillbirth, and eventually it can end up with low birth babies. And we can see that there is the major issue is our country is facing is fetal alcohol syndrome. When prolonged exposure of uterine alcohol can lead to fetal alcohol syndromes. And fetal alcohol syndrome means it affects the babies not only in the brain, the heart, and even eventually it is going to affect their physical and mental and emotional health too. So, and you think that there was one more question they were asking,
yeah, they were asking about when does actually alcohol affect the unborn baby?
Yeah. Because there are people thinking that the first semester is okay. No, there is not such time. Now, throughout the pregnancy, alcohol is toxic to the babies. And especially, we have to think that first 3 months, that is the time the brain and internal organs are getting developed. From an egg, the cells divide, then the all vital organs are forming. So the alcohol negatively affecting the cell activation, the gene activation, and plus all other brain synapsing and all brain formation, everything. So it's we can say that throughout the pregnancy, no alcohol.
I think fetal alcoholic syndrome is a new thing. It's a new keyword to most of the youngsters over there. The first question that would come to everybody's mind would be, how is it noticeable at birth?
Yeah, it's when you look at the babies, you cannot differentiate that much. Only some of them are underweight, lower. Then you can see some facial changes. Like a special small narrow eyes, some thin skin on the lips. Then you can see that if the mother was drinking moderate amount, you can see when the babies are born with high pitched cry, they're irritable. You can see shaky tremors, and you can see their heart rate is going up. Sometimes there is more. You can see more symptoms and signs. So what we do usually, we keep the babies under we keep it them ICU, the neonatal ICU, for the close observation. These are the things when the baby are born. But when you think for long term, most of the mothers are thinking this is the problem during the pregnancy and during the delivery. Then after that it is over. But this is not over. This fetal alcohol syndrome, it is like we can see more prominent from 8 months to 8 years of age. And it's not even finishing over there. It is affecting their development, physical, mental, emotional. You can see these babies when they are growing up, they have emotional stability problems, and they are always hyperactive, easily irritable, and you can see the behavioral issues and learning disabilities. Not only for reading, even sometimes speech problems. And as they grow up, there will be more. Sometimes it affects their joints and their development to physical and mental development. Then emotional, they get attached to anyone, even to strangers. They don't know where to say no. And sometimes they get into some inappropriate sexual relationship and behavior. And you can see when as they grow up, they are also ending up with using alcohol or drugs.
So, is there anything else that parents can do, or the family can? Is it just a support group, or is there anything else that the family can do to support these children?
Yeah, there is. Now the government, because they are very strict to not to use alcohol during pregnancy. But when the babies are born with fetal alcohol syndrome, yeah, it's very good if we can diagnose early and taking care of early, then their prognosis is going to be good, because it's a continuum of care. Like they need physical, mental, emotional support and therapies throughout their life. Yeah.
So this alcohol gets excreted through breast milk after pregnancy?
Yeah. Alcohol excrete through the breast milk. And I understand what is your question. Like the mother, when they are feeding the baby, what about? Yeah, like the breast milk, the alcohol excrete through breast milk, and the moderate amount of alcohol is going to affect the baby. The same thing, like the baby is still growing up, and internal organs plus brain are getting matured. So same thing, whatever is happening when the baby is in the mom's womb, how the alcohol was affecting, the moderate amount of alcohol is going to damage the baby's brain and the internal organs. And another thing also, just think when the mother is drinking alcohol, she is not physically and mentally or emotionally fit to take care of the baby. So that is, it's unsafe for a baby, the mom to use moderate amount of alcohol. Yeah.
So, is it okay to use at least one glass of wine during pregnancy, or are there
Yeah,
any
there is,
limitations?
there is some misunderstanding going through. People think, the wine, there are some, they are not counting wine under alcohol. But when you say alcohol, the wine coolers, beer, and liquor, all this coming under the category of alcohol. And there is no like a one glass sip of wine. There is not such a limit. During all pregnancy, completely abstain from alcohol. Even when you look at American College of Gynecologists and Obstetrics, plus the New York Royal College of Obstetrics and Gynecologists, they all are recommending or strictly telling no alcohol during pregnancy. Yeah.
So apart from women, what is your thoughts about if a male going, making
Planning to have baby, and that
planning to have baby?
yeah, of course, mother and father has got responsibilities, plus like when there is not much studies, but the alcohol affect the sperm motility. If a male person is taking moderate amount of alcohol, it is going to affect the male hormones, and it is going to affect the production of sperms. And plus, after all, physical, mental well-being, to become a father, that's a call. To become a mother, it's a call. So mother and father should be mentally, physically prepared to have the baby and provide each and every opportunity for the baby to have a safe environment and to work for the baby's physical, mental and emotional well-being. Yeah.
Is there something that we can conclude with today's topic just for the younger generation?
Yeah, my suggestion for the younger generation is alcohol is toxic. Luckily, adult body, yes, it get excrete through the moderate amount of alcohol through the adult body, but the babies cannot. So, our prevention is always better than cure. So we need our coming generation to be the best. So, going to be mom, going to be dad, please take care of. Thank you for the time, and thank you for being with me. And we are looking forward for the comment, and if it is helpful, share and subscribe it. Thank you.
Thank you.